Hey everyone, so we're going to talk about intake consents. So these are the consents that you're going to fill out after the assessment is done with a new client or maybe a returning client. So you're just going to want to be in their face sheet and you'll go to client drop down, and then there's this intake assessment intake consents section. So it's the third one down on the drop down. And what we're going to do is we're going to look at these numbered consents and all the ones sort of in between. So number one, the HIPAA consent, that's something that's usually done with the front desk when they are checking in for their appointment. And usually the multi-insurance consent is done at the same time, but once we have that client in our office with them, we just want to make sure that these two are filled out, because if they're not, we want to make sure that we grab them real quick. And then we're going to jump down to where it starts with 3, general consent to treatment, treatment policy and handbook, and we're going to go all the way down to number 9. So this whole section between 3 and 9 is what we're going to focus on in this video right now. So we'll start with 3, general consent to treatment, treatment policy, handbook. You can see I'm under test client right now, so you can feel free to pull up test client and try these out at your own pace. What you're going to do is you're just going to add a new one. So whether or not this is a brand new client or a client who is coming back for treatment, we always want to make sure that with every new treatment episode, we are adding all of these new consents, because the consents will expire 30 days after they've been discharged. So when they come back in, they have to sign all new consents again. So we're going to click this general consent to treatment, treatment policy handbook. We're going to create a service document, and it's going to open up this new service document. So you can see the client's name is up here, my name is here. And so while we're doing this with the client, we also want to kind of come up with our little spiel about explaining to them what's going on with each of these consents so that they know what they're signing. So it truly is informed consent. If they have any questions, this is a great time to talk to them about what the program's going to look like, what their schedule is going to look like. So for somebody who you are recommending for IOP, you're going to want to check this IOP program button and also individual sessions. If it's somebody for OP, you're going to want to check OP and individual sessions, right? Because they get groups and they get individual sessions. If it's somebody who's indies only, they're going to just get checked indies. Maybe you're also recommending like, okay, well, we'll start with individuals and we'll build up to them attending groups. So you want to make sure that the groups are checked if that's going to be part of their treatment plan. Your first group or individual session will occur on. So if I'm assessing them today on Monday and it's an OP group, it's like a Tuesday OP group, I want them to start tomorrow. So I'm going to put in that date, and this can be a really great way for the incoming therapist to just check and see like, hey, what was that conversation that you had with the client at time of assessment? When are they planning to start? Because maybe they've got a vacation planned and they're not actually going to start until the 16th. That's a great thing to notate in here. So days of the weeks that you are scheduled to attend individual and group counseling. So like I said, if it's a Tuesday night group, we're going to say Tuesdays from 6 to 8:10 p.m. You're just going to put the group schedule in here. You can also check like, well, it's possible that maybe they're going to come for individuals any of these other days too. So you can check those boxes. But for the most part, we're just going to check the box just so that it's very clear that they can see what their schedule is. So they know by looking at this, they're going to start on the 16th. It's a Tuesday from 6 to 8. And then there's all these things down here that talks about during your time at JADE, here's what you're expected to do. This is all illustrated in the client handbook. So we also want to make sure that when we go up to the front with them, we're going to grab a client handbook. We're going to write down their group sessions and their schedule with their therapist's name and contact information. But these are sort of the key points that you want to talk to your client about right there and then in the assessment. Hey, you know what? If you don't show up 3 times in a row and you're not talking to us, we might move towards discharge, but give us a call. We're going to try to call you too, but if we just don't hear from you and you disappear, that might sound like a discharge. So the way to avoid discharge is to make sure you're communicating with us. We're going to do random drug screens and maybe random breathalyzers. So don't be surprised if somebody at the front asks you to pee when you come in. It goes over like the cell phone rule in group too. It also is talking about violent behavior. So like none of these things should ever be a surprise to a person when they're coming into group the first time. Like they should know what's expected of them because you're talking about it at the assessment and you're also going to give them the client handbook that goes through everything in detail. So you can kind of come up with how you might want to talk about each of these sections with the client. We're just scrolling down here. Here's the telemedicine consent. So there's a lot of information on here. So this is the first consent that you really want to like really touch and make sure that they have an understanding of what JADE does and what is expected of them. Right here at the bottom, you're going to see this on all of the consents that we're going to go over to today. And it says, I've been offered a copy of this consent and accept or reject. So part of your spiel is like, hey, do you want a copy of what we're signing today? And if they say yes, you're going to click accept. And you're also going to print them out a copy too. If they say no, you'll just say rejected. And then additional comments. I never really fill in this box, but I think it's a great place, like just in case they have something of like plans to go on vacation, won't start treatment for another 2 weeks, just so it's in there. Okay, so once you get here, you're going to hit submit. You're going to do click to sign, and it will pull up a dialogue signature box. Going to use our 4-digit code to sign. Great, so you can see that it's all signed now. Next one, we're just going to go back to that drop down, go over to intake consents. This next one, number 4, MAT consent, overdose risk, relapse rate, naloxone. So we do want to make sure that we are filling this one out for every single person, regardless of whether they're going to do MAT with us. And this is really just documenting that we had that conversation with them. What is MAT? What does it do that we offer it? What might be of a benefit to them? What might not be, what we do here, what we don't do here, right? So there's methadone that's a very good option for many people, but we just don't offer it at JADE. So we want to talk to them about methadone anyway. We want to talk to them about buprenorphine, naltrexone. And then down here, these check boxes are going to just sort of document the conversation that you had. So what is your clinical recommendation for MAT? And for this client, I said, well, buprenorphine is my recommendation for them. And what's their choice? They agree. They also want to do the buprenorphine. Now, it might be different sometimes. Maybe I'm recommending Suboxone, and they're saying, no, you know what? I just want to do abstinence only. I'm going to withdraw. I'm going to detox on my own, and then I'm just going to move straight to abstinence. If they're talking about Revia or Vivitrol, you want to check this naltrexone. Or maybe sometimes no MAT services would be recommended. I would say for the most part, for the people that we see, we do want to be talking to them and having that conversation about MAT. It might be pretty rare that you're checking this no MAT services recommended box. They can also refuse recommended MAT services. That's totally fine too. And then if we're doing buprenorphine, the client initiating the following services. So are they actually going to start buprenorphine? We recommended it, they accepted it. Are they actually going to do it? Yes. And then the other option here is buprenorphine internal services. Is JADE going to offer it? Or maybe they're getting it from an external provider. So you just want to click yes or no, just saying which one. If you click no, it's going to ask you, hey, well, where are they getting it from? Where did they start? You know, maybe they've been going there for a couple months now. We're just going to fill that in so it's all documented, and hit submit. And then the next section is talking about Narcan or naloxone access. So we want to have that conversation. Hey, do you know what an overdose looks like? Even if you yourself are not at risk for an overdose, have you seen one? Are you around other people who might be at risk for an overdose? You're going to do like a real mini, super short overdose and Narcan training with them right now. And you're going to make sure that you're offering them Narcan. Every single person that we assess, we're going to offer Narcan no matter what. It's their choice whether or not they want to accept it or reject it. That's up to them. So was a prescription of Narcan offered today? Yes. You always want to say yes here because you always want to be offering the Narcan. And then was the Narcan prescription accepted or rejected? For the person that I'm talking to, this sort of imaginary person, they rejected it. They said, you know what? No, I'm good. I don't need it. And I say, don't worry. You can change your mind. If you ever feel like you want Narcan at all, come talk to us. We'll get you some to take home with you. And we're going to hit submit. And then we're going to sign it. Done. All right. So then we're going to go next to the next one. So this one's not numbered, but we do want to make sure that we are grabbing this consent from every person. This is the reminder call consent. And this is because we partner with that Vital Interactions. We're going to choose Vital on this drop-down list. provided by, it's always going to be self because self is the one that's filling out these consents. So this is just saying like, hey, I recognize that JADE is using a third-party program for contacting me on behalf of JADE. So we're going to send them text messages reminding them of upcoming appointments. We're going to give them phone calls reminding them of upcoming appointments. We can communicate or chat with them through the Vital Interactions portal too. So this is really just them saying like, yes, I recognize that we're going to use a third party to do this. Your consent period is usually going to be about a month, or not a month, a year from the date you started to the date it ended. We're going to hit submit. We're going to sign it. Okay, easy peasy. We see how this is working. Next up is this acknowledgement of lab order policy. This is also an important one, even though it's not numbered. We do want to make sure that we're grabbing this from everybody, and it's basically that lab order policy saying like, hey, we might send your urines out to the lab. This is an important conversation to have, especially with people depending on what insurances they have. So for people who have Medicaid, so like CCBH, VBH, BHO, Beacon, all of those Medicaid plans, we are absolutely 100% sending their urines out to Quest or LabCorp. It's usually Quest though, just to confirm that what we're seeing in our on-site cup matches what the lab is picking up, and the lab is also going to be able to look at levels too. So we don't usually send labs out for commercial insurance. So that might be a UPMC or a Highmark, just because it ends up costing them a lot of money to send out. So this is a conversation that you want to have with them right now. If we might need to send it out, you know, if you're saying you didn't use something and it's coming up positive in our cup, we want to confirm with the lab what's going on. So you might end up getting a bill, but if you do get really high bills, come talk to us. We'll sort of try to like figure something out. But if you do get a bill from Quest, you are responsible for it. So again, we're asking, hey, do you want a copy of this consent? So accepted, yes, we're going to print out a copy for them. Rejected, no, we're not going to print out a copy. I'm going to say accepted for this one, and I'm going to show you how to print that copy out in a second. So we'll hit submit. And we'll sign it. It's going to take us back to that page, and so this is the one I just did. It's the newest one right here. To print these out for clients, what we're going to do is we're going to hit report, and it'll pull up this new tab that'll print out nice, it looks like a one-page max. We'll just hit print, and we can send it to, I'm in Wexford right now, we can send it to Wexford. Here's exactly what it says and what we went over. Here's our signature, here's my signature, and we can hand it to them at the end of the assessment. I'm not actually going to print it though. So after the lab orders, the next one up is the SCA grievance and appeal. You're going to want to make sure that you're using this add button every single time. I already created some of these just for ease and just to make sure I didn't miss anything while I was recording this for you, but you want to do this add button. So click on this. I'm going to click on this though. So we're opening up this SCA consent group. So again, this is another one with these radio buttons. We want to click this SCA consent to release information, grievance and appeal, create service document. I already created it, so I'm going to go up here to this one that's not signed. But you, when you're walking through, you'll create a whole new service document. So this is what it looks like when it pulls up. And the conversation that I have here is, hey, from time to time, Allegheny County comes in and oversees our state license through DDAP. And what that means is, you know, they're not interested in your treatment or your care or how well you're doing or maybe how well you're not doing here. They're concerned about making sure that we are doing our absolute best and we're doing what we're licensed to do. And so, you know, that might be from SCA stands for Single County Authority. Our office is on Smithfield Street in Allegheny County. You know, they might come in once a year, twice a year, just to make sure that everything's looking good on our end. Also, sometimes your insurance provider might want to audit your chart just to make sure that we're doing everything that looks good. So this gives them access to your records here. And again, like I said, they're not concerned about you and how well you're doing. They're concerned about us. So we're going to click these boxes. This is the purpose of disclosure. This is where funding box comes in, this is where I might also talk to them if they're an Allegheny County resident about ALDA. And I might say something like, if you were to ever lose your insurance, please come to talk to us. We have some grant funding available called ALDA, and we might be able to get you hooked up with funds for your treatment here at JADE, or maybe some medications too. So just talk to us. And again, if we're offering a copy, accepted or rejected, we want to click one of these boxes. And then this is the first time I believe that we're seeing this authorization to revoke consent. So this is going to happen on some of these consents that we're moving towards now that are, below this one on the drop down. But it's having that conversation with every single client saying, hey, you can take this consent back. If you feel uncomfortable about it, or if you want to change who we're releasing your information to, you have absolute every single right to revoke consent. And that the keywords here are verbally or in writing. So they can just call you and say, hey, that SCA consent that I signed, I don't want that anymore. I'm going to revoke consent for that. And you say, absolutely, cool, no big deal. And I'll show you how to revoke a consent in the system too. So the next one you might notice over here on the left, this is a two-parter. So the second part is this grievance and appeal process. And you do want to make sure that you hit submit in between. I'll do that so it saves our work. So grievance and appeal process is saying, hey, if there's ever any problems that you have at JADE with our treatment or our counselors or anything that's going on, we do want you to come talk to us about it. But you also have this right to file a grievance with that single county authority, the SCA that we just signed that previous consent for. So this outlines every single part of how to file a grievance, and I can also help you if you would like that. And I'm going to give you a client handbook, and all that information is going to be printed in there. There's a little worksheet that you can fill out if you want to file a grievance against us. But again, please just come talk to us just to see if we can resolve something first. And so I have received the SCA grievance. Yes, you're always going to say yes, because we're going to give this to every single person. It's going to be included in their client handbook, and we're giving a client handbook to every single person. So this answer is always yes. And then you ask them whether or not they want a copy of this, accept or reject. Most people don't want the copies just because it's a lot of paper, especially if they know they're already getting a client handbook and all this stuff is going to be duplicated in here. So we're going to hit submit. And sign. And my signature's all funky. What you're going to do is you're going to go back to that drop down and say they want to revoke that SCA consent. We're going to click on it. We're going to find that most recent one. And instead of clicking this or creating a new one, we're going to do this sent revocation. We're going to create service document here. So you can see they originally signed it on this date, and then we're revoking it on this date. And so I wish to revoke either the entire authorization, because remember, this was the release for SCA and this was also the grievance and appeal process too. Or you can click other, because maybe they only want part of it. So if we kind of go back and look at this release, it's important to know what's covered in every single release. So we said admission, continued stay and discharge, continuing drug and alcohol, eligibility determination, coordination of care, and funding. So, maybe for whatever reason they say, you know what, I want to revoke the funding aspect. I've never heard anybody do that before. But we can click other, we can say funding. They do not want all that ever. They're going to revoke it as of today. Reason, they just declined. You can kind of put in whatever rationale in here. If you're having a conversation with them, they're probably telling you a little bit more of a story about the reason why they want to revoke it. So you can just type that in there. Specify type of consent being revoked. So we're just going to say it's that SCA consent. And specified name of agency or person, SCA. Date and time it was created. So again, we want to look up here. This is the date and time it was created. So initially it was 4/28 at 7:37 a.m. You can see that I am at work early. I'm submitting it, and then you're just going to sign. You're going to have them sign, and then you'll sign too. I don't have the Topaz set up to my laptop where I'm recording all of these things, so this video might look a little bit funky because I'm sort of piecing together videos of me signing it on a desktop, but you do want to make sure that your Topaz is set up on whatever device you're using to have them sign. Otherwise, you're going to get this error issue where it's just not going to let you do anything no matter how many times you click. So this next one up is going to be the multi-pharmacy consent. So it's this number 6. And this is if we are going to be prescribing the medications or if we need to get in contact with the pharmacy. So remember, we can't release any information to anybody outside of JADE unless there is a consent on file, pharmacies included. So this is really important that we grab it at the time of assessment. Usually the nurses will grab it at the time of new patient med check if you forget, but we just want to make sure that we are doing everything that we possibly can to make everybody else's life easy. So you want to ask them, hey, what pharmacy do you think that you'll go to get your meds filled? And so you'll just click the box of whatever they say. For example, this test client, they weren't sure if they were going to go to Giant Eagle or CVS, so I clicked both, and they'll sort that out with the doctor when they see them for the first time so that the doctor knows exactly where to send the medications to. And you can see right here, the purpose of disclosure is for coordination of care and dispensing medication. And then methods of release, we want to check verbal and copies, which allows us to call in a script or fax something over or send something over electronically too. So we want to make sure this one is checked. And again, you're offering them a copy, accepted, rejected. This person doesn't want a copy, so I clicked rejected. And they understand that they may revoke all or part of this authorization. So maybe they switch pharmacies, maybe they get in a fight with the pharmacist at Giant Eagle and they want to switch to CVS. So we would revoke the Giant Eagle portion of the consent. That hardly ever happens, but just so that they know that they're able to do that. And you're going to click submit. And sign. And that list in order so we don't miss any. So the next one's going to be this family involvement and emergency consent. This one is so very important to make sure that we have on file for them. In the event that something happens to them on site, we always want to have an emergency contact available to call, to contact, to say, hey, this person, needs medical assistance. They're going to the hospital in an ambulance. Here's what happened. Here's where they're going. And you can also opt to check additional boxes if it's family involvement in consent. So I'm just going to uncheck all of these so that we can just kind of see from beginning to end. So you want to ask what's the name of your emergency consent? You're not even going to give them an option of, do you want an emergency consent on file? We're just asking, what's the name of the emergency consent? So Jiminy Cricket sounds like a great idea here. I don't know if I spelled that right. And we're going to say best friend. You can grab their street address. We don't need the full thing because we'll never be sending them mail, but sometimes it's just nice to have this so that we can on the phone verify that they are who they say they are. So, maybe they live at 555 First Street in Pittsburgh. I don't know. Phone number, you'll want to type that in. And then, so this is for the emergency consent. So we'll check emergency consent and nature of the emergency and location of client. So that is the bare bones of the emergency consent. You can also say, hey, do you want to be able to release any additional information to your best friend, Jiminy Cricket, in the event that maybe they want to come into a session with you, maybe they want to call for treatment updates, make sure that you're coming, anything like that. And so maybe the client says, yeah, absolutely, that sounds good. They can know whatever they want to know. So you're going to check family involvement in treatment, and you're going to click all of these boxes too. You might want to have the conversation like, is there anything you wouldn't want them to know? And maybe they say like, well, I just really don't want them to know that I'm on Suboxone. And you say, okay, cool. So we're going to take prescription medications out. We're going to take medication records out. We'll probably take medical history status out. We'll probably take lab reports out because the buprenorphine would show up in a lab report. So you can really just make this be exactly what they want it to be, or you can put other, and you can actually physically type in here, does not want to release info about meds. So then it's very clear what's going to be in here. Again, they can reject it. We want to do verbal and copies just in case they want a letter, they want to talk on the phone, they want to come in person, whatever it might be. They can revoke it. We're going to hit submit. We're going to sign. They're going to sign. Moving right along. Primary care physician, again, this is another really important one that we want to make sure we grab from them, especially if they're going to be meeting with one of our physicians for medications, for diagnosis, for anything at all. We want to be able to coordinate care for any other prescribers in their life. So you can see I kind of pre-filled this one in, but it's sort of the same gist as the emergency contact. You want to put the name of the physician, the agency, their street address, a phone number, a fax number if you have it, and then click any boxes that appear to be appropriate to communicating their treatment. So I already signed this. Harry Potter, our client, signed it too. Is this aftercare phone call consent group? So this one is also really important to at least offer or give. So what we're going to do is you would click this aftercare follow-up consent and create service document. When you're doing a discharge, you would go back to the same one and do the follow-up call DC, create service document. But just for the intake process, I already started one, so I'm going to open it up. And this one is just saying like, hey, I'm giving you permission to give me a phone call after I've been discharged, just so we can follow up and check in and see how they're doing. So I always want to grab a phone number, not off of their face sheet, but I want to make sure that I'm asking them for a phone number at the time that they're sitting in front of me, because sometimes what will happen is they will call for their pre-screen and give a phone number, or maybe we know them from a previous treatment episode and their phone number has changed since they're in front of you. So you just always want to make sure that you have a new phone number. So they're saying, I agree. If they refuse, you would say, I do not agree, and then we would know not to call them at discharge to follow up with them. Put their new phone number in here, and then there's an option to click whether or not they have legal involvement. So this is the example for no. If you click yes, it'll open up more dialog boxes. So maybe they're involved with drug court. So you'll say like Allegheny County Drug Court. Now this is not a consent to release information to JRS or probation or drug court. This is just saying and prompting you, if you're opening this at the time of discharge, that maybe you want to coordinate communicating discharge with some of these people. So we'll say, you know, maybe their JRS worker is Bridget, maybe their PO is, I don't even know, maybe they get a new PO and their name is Becca. Great. So again, they can be offered a copy of this, accept or decline. We're going to submit. They sign, we sign. Ask them like, hey, is there anybody else that maybe we haven't signed a consent for yet that you would want us to be able to talk to on your behalf, or that you would want us to be able to release information to? And so you're going to go to this drop down and kind of try to find if there's anybody else that they can think of. So maybe JRS or probation officers or lawyers or other family members that they haven't signed for. Those are all options. So these consents are sort of scattered around. So some might be in intake consents, some might be down here in consent unspecified, or other treatment facilities, or other pharmacies, or insurance companies, or probation parole. So like the justice related service one is here, or maybe they're also going to do a probation 5-point consent. So the 5 points refers to PA Code 255.5, which was recently sort of done away with. So now we're following 42 CFR, but the 255.5 talks about we can only release these 5 points of information. That's why it's called a 5-point consent or a 5-point letter. So we are still following that. We are still signing them just to help us limit the information that we might be giving to probation officers or JRS or anybody else. But it kind of walks you through all that legal code right here that's talking about that 42 CFR Part 2 or the 255.5 code that's down here. And if you haven't taken the DDAP confidentiality training yet, definitely go do that, because in there they're going to talk about parts of the consent, what makes a valid consent, what doesn't make a valid consent. It always has to have the client's name and unique identifying number on here. It has to have your name or a witness. It has to have the document date. It's really asking that you're as specific as possible when you're doing consents. So, you know, you can't just put the name of PO and the agency Allegheny County. They really, you know, if DDAP came in to audit us, they would be looking at being a little bit more specific. So you would want to say like Joe Schmo as the name. I guess it auto-corrected for me, who works at Allegheny County Probation. You would want to give, you know, what's his office number, I'm not super sure, zip code, we'll put him in the north side of Pittsburgh. And then what's his phone number, what's his cell phone number, what's a fax number, what's a good email address for him. Probation usually looks a little bit like this with that AlleghenyCounty.us. And then you're going to ask that client, hey, is there anything that you don't want them to know? And just kind of explain to them what the 5 points are, what we are allowed to say, what we're not allowed to say. If you have any questions, definitely give me an email about those 5 points, because I think it's a little bit more information than what I can go into in this little video right now. But we're going to hit submit. Have them sign, you're going to sign. And then that's about it. Again, you can kind of go navigate these drop downs under test client or under really any client just to see and get familiar with what's going on. There's one for group rules here, which is sometimes kind of nice if you have somebody that's, violating group rules quite a bit. You could have them sign it again and give them a copy of it. There's a family day group consent down here. So if you're doing, IOP and you're inviting family members, you can open that family day group consent and take a look at it. Really only releases information for 1 day and then it expires, and that's how it was set up to be. So it's not like that emergency consent or family consent, it's just family day. So you're going to limit it quite a bit. Maybe we're only talking about disease concept and support system and family dynamic and really nothing else. And so if my group's today, my authorization is going to expire tomorrow because we don't need them to have authorization more than that. So you can just kind of keep on going, continue. Oh, we have to do a name here, I guess. Relationship mom. My mom's name's Sandy, so I'm going to write that one in there. So we're going to submit. And so if you miss a part that's required, it's going to tell you. And I think I missed that part. So there you go. Have them sign, you move along. Any questions, again, feel free to get in contact with me, Dan, Alex. Emily's great at consents. Just reach out to anybody. No question is a stupid question. This is all kind of really confusing, and it takes a lot of information about ethics, about confidentiality to be able doing this right. But the more you do it and the more times you answer questions that clients will ask you, the easier it'll be.